Welcome. My name is Dr. Bill Farrell. I'm a practicing orthopedic physician and surgeon at Midwest Medical Center. I would like the community to be aware that we started an osteoporosis clinic here in December of 2020. In medicine over the past 10 years or so, there's a major emphasis on wellness, and insurance providers emphasize wellness in all aspects. We talk about diabetic wellness. We talk about cardiac wellness. We talk about bone wellness or bone health. Unfortunately, osteoporosis has not been popularized often enough. Over 50 million individuals have osteoporosis in the United States, and it is unfortunately an underdiagnosed and undertreated disease. Once a month, we have a clinic here that will assess whether the individual is at risk in terms of calcium and vitamin D levels, at risk in terms of a bone density study, and more importantly then, if they are at risk, the whole idea is on fracture prevention. Hip fractures, spine fractures, what we call insufficiency fractures. When I started in orthopedics in 1980 as a resident and 1985 as an attending, there were very few good, if any, treatment options. It's more than just taking calcium and vitamin D and walking. That's important, but there are now good medications and injectables on the market that can help with that disease process. In addition, it's a matter of educating the individuals at the clinic. And so I do provide some general information from the National Osteoporosis Foundation on how strong are your bones, as well as bone basics and the amount of calcium and vitamin D that one should take. It is all about preventing fractures. It's all about preventing secondary fractures with good treatment options by today's standards. The important thing to know is that any communication and testing that I perform will be made available to your primary care doctors. And so we as a team then will work together to try to minimize the potential for problems with respect to bone health. So I would encourage individuals to make an appointment if at all possible. And the clinic is run once a month. If it becomes more popular, then we will have it more than once a month. But the idea is to diagnose and to provide wellness. Essentially, insurance providers want to keep patients out of the hospital. And so this is one way that I can provide a service for the community, which, as I said earlier, is a very underdiagnosed and undertreated entity. Thank you.